Hello everyone, this is Dr. Aditya Gupta. So in this video, I'll tell you how to use first aid, the true game changer as far as your preparation for NEET PG or INICET is concerned. Alright, this is a book. I still have my first aid with me. God forbid if I have to again prepare for NEET PG or INICET, I'll again use my first aid. This is a book which I really value. This is a book which I genuinely credit for my success, for reason I got All India rank 17, for the reason I got succeeded in AIMS PG back in the year 2018. I credit this book for that success, and it's a book which has been used by a lot of AIMSonians. And this has been, earlier it was something which was restricted to AIMS. A lot of AIMSonians, me, Rishabh, my friend Rishabh Jain, Zainab, all of us promoted this and told that it's like a really good book. And that got a first. That's why I want to remove the first misconception from your mind. Okay, that a lot of people actually think that because AIMSonians were the ones promoting it in the beginning, that only AIMSonians can do it, or someone who's like really intelligent can actually use first aid. Other people, average people cannot use first aid. So first of all, I'll tell you, no, anyone can use it, and anyone who has used it has gotten a tremendous benefit out of it. Alright, this is a Twitter post from a junior of mine, Dr. Prayas. I've actually met Dr. Prayas. I met Prayas. So if he's watching this video, hi. Yeah. So this is how the post started. What he did differently as an average student. He himself categorizes himself an average student. He's an average student. He himself told me that for the first 2-3 years in MBBS, he did not read anything. It's only in internship he suddenly realized that he has to crack the exam. And the very first thing he says that first aid is a true differentiator. Even an average student can use it. It doesn't mean that you have to be above average, you have to be intelligent to be able to use first aid. Anyone can use first aid, and let me tell you, those who use first aid will swear by it, will tell you that it's truly a differentiated, truly is a game changer if you're able to use first aid the way you are able. And he himself shared some images of his annotated first aid. Alright, so for those who understand in Hindi, I will say the घड़ी का dialogue. पहले इस्तेमाल करें, फिर विश्वास करें. If you don't believe me, first use it, and then you will realize why I speak so highly of first aid, why I genuinely like this first aid. Coming to the actual how to actually, why is first aid important, and why does first aid help. So in the last video, yesterday video, we talked about that you have to concise your notes. You have to get your notes from around, you cannot revise 10,000 pages of notes. You have to get your pages from 10,000 to around 2,500. This is something which is doable in last 10 days. And if you're not able to revise in the last 10 days, unfortunately, on the actual exam day, you really won't be able to, get hold of those actual MCQs correct. You will fumble, you will get confused between two options. So you need something which is revisable, and the main notes, unfortunately, are not revisable. So you need to concise them. And I told them how to concise them. For concising your notes, for the first and second prof subjects, there is no better book than this first aid. I concise my final prof subjects notes. For the first and second prof, everything was this first aid only. Now I'll tell you how does this first aid work. How does first aid actually work? Now, this is the example which I give in all the videos. In my previous videos, I've given this example only. Take amyloidosis. You read amyloidosis from your main notes. This is 151, 152, 153. Amyloidosis in the marrow notes is 6 pages. In, let's say, DBMCA1, it will be 4 pages, 5 pages. Preplad, it will be 5 pages. Everywhere amyloidosis will be 5 pages. Alright. But like I said, you have to concise it down. You have to get it down to 1-2 pages of the actual important information. Yesterday, I told you how to concise, 4 pages of cystic fibrosis into like maybe half a page of cystic fibrosis. How do you use first aid? First aid has already concised amyloidosis for you. It has already done all your hard work. जो तुमको मेहनत करनी थी लिखने में, first aid has already done that. Somebody has already done that hard work. Amyloidosis, can you see? Amyloidosis is concised only into one single page. Those 6 pages have suddenly been magically converted into 1 page. And that is the magic of first aid. One will be like, sir, you have written these small things here. You have written this small things here. I've written 1, 2, 3, 4, 5. Around 6 odd lines I've written here. Or 7, maybe 7 odd lines, another lines I've written here. So what are these lines? So you have to annotate your first aid. So remember, first aid is a book for USMLE first aid. It's for USMLE. You have to convert this book into a NEET PG book. That requires a little bit of annotation. So I would say that read your main notes. On one side, you read your main notes. You have these 6 pages of notes. Simultaneously have your first aid open. Let's say you're done with the topic for the day, or done with some subjects for the day. For example, let's say you did journal part today. In journal part, see first aid. See, most of the things in journal part would already be done in first aid. Solve the previous year question. Solve all the past 5 to 7 years. I would say Marrow, I think, has 7-year previous year question. If you want to go further back, which I would recommend, in case you're preparing for INICET, I would actually recommend using Reflex, because Reflex has 10 years of previous year question. So that gives you an advantage as far as INICET is concerned. INICET loves to ask its previous year question. So you can go for, and it also has topic wise PYQs. Reflex also has that advantage. Otherwise, you would be, making 5-10 minutes and making custom modules. That's an advantage over Marrow. But if you're using just Marrow also, that's perfectly fine. Marrow also is obviously Marrow is the gold standard as as far as Qbank is concerned. Nobody can deny that. So whichever platform, Qbank platform you're using, if let's say you did journal part today, all right, you were thinking I will do pathology over for 4 days or 5 days. Let's say on day one you did a portion of journal path, all right, did not do hematology, did journal path. Make a custom module using recent NEET and AIMS along with general path topics only. Just do that custom module. You will realize that, okay, the things that you have missing from, let's say, the things which are important, which are given in the explanation of those previous year questions. Let's say there is a previous, there are 5-7 previous year questions on amyloidosis. You are able to solve most of them from first aid. Maybe 1-2 questions you're not able to solve from first aid. That extra information. So let's see what information I had written. So I had written about one extra stain. I felt that this is important. I had written about thioplavin TNS, although that has been not been asked. I written about the 2 types of spleen that was not there in first aid. I had written about the most common cause of death, because in India they keep on asking these most common cause of death. So these 3-4 things you can add on to your first aid. All right. So you did your main notes, simultaneously opened your first aid. You solve the, like I said, you are solving the PYQs on a daily basis. Hopefully you're doing that. You did the previous year question, whatever missing information was there from the important topics, whichever missing information was there from in the explanation of this previous year question, few points from there you add to first aid, and that's it. The concise point is done. Concising of your notes is done. You don't have to write it down. And that is the magic of first aid. And now, like I said, January, February, March, the next 100 days is for the first read and concising your notes so that you are able to revise in April and May and June. When April and May comes, when you start revising from this, you will realize how amazing this book is. Revision. This first aid has path, pharma, micro, biochem, physio, psychiatry, and if you annotate properly, path, pharma, micro will cover medicine also. So 50% of your syllabus in just these 700 pages. That's the actual magic of first aid. All right. So again, I'll repeat, go back to the original first video which I made on 1st of January. Again, Happy New Year to all of you. So the first 3 months, the next 3 months, or those who have started, if not first 3 months, if you have started a little bit earlier in December when the exam notification came, maybe till February end or mid of March, all right. The first 3 months are to do the first read and simultaneously, and this is a very important thing, simultaneous. You can't be in April, you can't go to April and say, now I can't revise. That would be a blunder. Right? So right now the goal is read, do the first pass of previous year question, concise your notes, or use first aid. And I would recommend first aid, use first aid. And then when the time comes in April and May, shift to revision. And then do 2-3 revisions. And we are able to do 3 revision and a last 10-day revision. You are golden. No one can stop you from getting a top 1,000 or 2,000 rank. That's a guarantee from my side. All right. At that point of time, don't get in FOMO. Stick to your concise notes. Stick to first aid. Stick to solving GTs and important topic modules. And that's it. You don't need to look here, there. He's there doing that. Wo ye kar raha hai. Don't need to do that. Stick to your actual source. Don't go into FOMO in April and May and June. Right? Right now, broad read and everything. So this is how first aid works. 6 pages suddenly concise into 1 page. So your main notes, path, pharma, micro, all these pages will be around 3,000, 4,000 pages. Medicine itself is 1,000 pages. If you annotate the algorithms, you do your path, pharma, micro properly, you are 700 pages. This is the magic of first aid. So what I'll do for you guys is that I have in the link, there's a link below. This is my own website. You'll find my annotated first aid. It's for free. Enjoy. But remember, I'll say that I am going to give it for free only for 2 days. The reason I'm good for 2 days is because I know there will be a Chaman Chutia who will put some copyright strike on it, because this is technically McGraw-Hill or something like that, right? So मैं 2 दिन के लिए रखूंगा, then I'll remove it. Okay. Have it. See how to actually annotate first aid and go about it. Alright, so you will find the link in the description for my website. There are some notes. It's Divya's notes. It's pediatrics notes. Those are concise pediatrics notes, which she teaches in her Bhatia classes. If someone wants to buy them, that's perfectly fine. It's kind of an ebook. It's around 150-200 odd pages of pediatrics. Ideally, I would say if you're doing some other source, you should concise it yourself. If you're not done pediatrics, you can consider that. That's a totally different. That's totally dependent upon you. But I would definitely recommend everyone to use first aid. Definitely recommend everyone to use first aid. Like I said, buy first aid, see first aid, and पहले इस्तेमाल करें फिर विश्वास करें. Anyone who has used first aid will swear by it. It's genuinely a differentiator, and it can genuinely boost your rank. Alright, that's it from my side today. Thank you and have a nice day. I'll see you tomorrow with another video on this NEET PG series, NEET PG 2025 series. Tomorrow probably I'll talk about how to use Qbank effectively, how to solve previous year question, how to get to know what are the important topics, how to solve PY, solve the Qbank, and how to practice GTs will come in 1 or 2 days. Alright, so that's it from my side today. Thank you and have a nice day.